Endoscopy is a medical procedure that allows doctors to examine the inside of a person's body using an instrument called an endoscope. An endoscope is a flexible tube with a light and camera attached, which provides real-time images of internal organs. This procedure can be done for various reasons, including diagnosis, treatment, and monitoring of conditions. Common types of endoscopy include gastroscopy for the stomach, colonoscopy for the colon, and bronchoscopy for the lungs. Patients usually are sedated during the procedure to ensure comfort, and it typically lasts between 30 minutes to an hour. Gastroscopy is a medical procedure used to examine the lining of the esophagus, stomach, and the first part of the small intestine. It involves using a thin, flexible tube called a gastroscope that has a camera and light at the end. Gastroscopy helps in diagnosing conditions such as ulcers, inflammation, and cancers. The procedure is usually done under sedation, ensuring the patient remains comfortable. After the examination, healthcare providers can discuss findings and recommend further actions. A colonoscopy is a medical procedure used to examine the inner lining of the large intestine. It involves using a long, flexible tube called a colonoscope, which has a camera at its tip. Colonoscopy helps doctors identify conditions such as polyps, tumors, and inflammation. The procedure is usually conducted in a hospital or clinic, often under sedation for comfort. Patient preparation is crucial, involving dietary restrictions and cleansing of the bowel beforehand. Bronchoscopy is a medical procedure that allows doctors to examine the inside of the lungs and airways. It involves using a thin, flexible tube called a bronchoscope, which is inserted through the nose or mouth. Bronchoscopy can help diagnose conditions like infections, tumors, or chronic cough. During the procedure, tissue samples or mucus may be collected for further testing. Bronchoscopy is generally safe, but like any procedure, it carries some risks.